pain or anything, but so James over here, dude doesn't know how to use his hamstrings and his abdominals because his low back, his spinal extensors are so super engaged. So they're literally pulling his spine and rib cage into extension, his pelvis into anterior rotation, or just sticking his butt out, Donald Duck-wise. Puts a lot of tautness, T-A-U-T-ness, in his abdominals and his organs in the front. So it looks like he's sticking out his belly. It looks like he has a big fat belly, but mostly it's because of his positioning, okay? So rolling out his hamstrings to stimulate them, to wake them up a little bit, okay? Then I'm gonna roll out his back. It's an 80-pound tempering roller. So I put it on the bottom of his sacrum right now, his tailbone, and I'm pulling his tailbone down, counter nutation-ish. Also pulling his pelvis so he can tuck his tail in a little bit more effectively. And I'm just letting gravity and this 80-pound roller just sink into it so it can give his brain a little bit of a reason to disengage those spinal muscles that are giving him a little Donald Duck butt anterior rotation of his pelvis, okay? So, roll a little bit of the tissues around the tailbone. Now, I'm gonna put it on his back. You can see right away, he's got a little type 1 dysfunction, as they say in osteopath terms. There's a little bit of a rotation in his lumbar spine to the left. That's okay. I don't know what that means. All I'm doing is rolling, tempering. So you could also scan the soft tissues with the temper, with the roller. You can feel a little bit of resistance, some of the increased tone and hypertonicity of some of the tissues and how they react to the weight. With all that scientific jargon out of the way, just think of a steamroller effect. Right now I'm creating a little distraction, his pelvis from his spine, his lumbar spine. So crackle pop. So go a little bit more on his left side. Hang out here for a bit. Right side, what a difference on that right side. A lot of space on his right side. When I go over here, not a lot of space because he fires those left spinal extensor muscles a hell of a lot more. He's pulling his spine into rotation to the left, pulling his left ilium or pelvis forward in anterior rotation. So I'm just going to counter that with the weight. Here we go. There. Breathing differently. You can feel when the client breathes deeper, you feel the excursion of the rib cage. Whew. They're able to take a deep, bigger breath. Not bigger breath, but more expansive breath. That's better. So go back here. Back to the hammies. Now, because I want him to wake up his hamstrings, switch my position. Okay, so keep them here. Okay, James, I want you to nice and easy bend both knees. There you go. You're gonna do it 5 times, all the way. Feel the hamstrings. That's 2, 3, 4, 5, and relax. Okay. Good job.